Liver transplant. At first we will know about a liver.
Now let's take a closer look at the liver to really understand what's going on. This reddish-brown wedge-shaped organ is the liver. It's located on the right side of the body, below the diaphragm and overlying the gallbladder. It's the largest and heaviest internal organ in the human body, weighing about 1.5 kilograms. This is about 2.5% of an adult human's body weight. The liver is responsible for many important functions, including the detoxification of harmful substances, protein synthesis, nutrient storage, and the production of biochemicals necessary for digestion. It's one of the most vital organs in the body. If your liver fails and you don't get a liver transplant, you die.
What is liver transplant? Liver transplantation or hepatic transplantation is the replacement of a diseased liver with the healthy liver from another person. Types of liver transplant procedure. 1. Orthotopic liver transplantation. 2. Heterotopic liver transplantation. 3. Reduced size liver transplantation. In orthotopic liver transplantation, the recipient's diseased liver is completely replaced with the healthy liver. In heterotopic liver transplantation, the donor liver is placed within abdominal cavity, with patient's native organ occupying the normal anatomic position. In reduced size liver transplantation is done on children and involves the transplanting a part of the healthy donor liver into a patient. A whole organ liver transplant.
To begin the procedure, we need to remove the diseased native liver. To do so, we divide the blood supply and the bile duct. We first divide the right and left branch of the hepatic artery. The common hepatic and cystic ducts are divided. The portal vein is divided. A clamp is applied to the inferior vena cava, or IVC, below the liver. Another clamp is applied to the IVC above the liver. The hepatic veins are divided. The IVC is divided. The IVC is divided below the liver. The diseased liver is removed. In preparation for the vascularization of the to-be transplanted liver, the openings of the hepatic veins and the vena cava are made into a common channel. This maximizes the outflow of the to-be transplanted liver blood flow. We also create a common opening for the hepatic artery. A whole organ transplant is when the entire liver from a deceased donor is used for transplantation. We begin by connecting the top of the donor IVC to the patient's IVC. Then the IVC below the liver is connected to the patient's IVC. Next, the portal vein is connected, the clamps are removed, and blood flow in and out of the liver is restored. The hepatic artery is connected. Lastly, we connect the bile duct. It is common to be in the hospital for several weeks after the operation.
A living donor liver transplant.
A living donor transplant is a procedure to remove a piece of healthy liver from a living donor and transplant it to a person with a diseased liver. During a partial hepatectomy, a piece of healthy liver will be removed from the donor. To begin, an incision will be made in the abdomen. First, the surgeon will remove the gallbladder. This is because the gallbladder is attached to the piece of liver that will be removed. Next, the right side of the liver will be divided down to the main blood vessels and bile duct. They will be tied off and divided as well. Then the right side of the liver will be removed. At the end of the procedure, the surgeon will place a drainage tube in your abdomen, and the incision will be closed with dissolvable stitches under the skin. The procedure to transplant the donated liver will begin with an incision in the recipient's abdomen. The surgeon will divide the blood vessels and bile duct attached to the diseased liver. Then, the diseased liver will be removed. Next, the healthy donor liver will be attached to the recipient. At the end of the procedure, the surgeon will place a drainage tube in the abdomen, and the incision will be closed with staples. After the procedure, the recipient will need to take anti-rejection medication. It will keep the immune system from rejecting the liver. Over time, the recipient's new liver, as well as the donor's remaining liver, will regrow. It takes about 2 months for most of the liver to regrow.
To be continued. Give support to me by subscribe my YouTube channel. Do check out my video and subscribe to my channel. I would like to hear your feedback.